Anxiety and depression are among the most common disorders. Like 1 out of 3 people will have depression at some point in their life.
The World Health Organization recently showed that there is a 13% increase in diagnoses of mental health conditions over the past 5 years.
It's both health-related quality of life for people who suffer from these disorders, but they also impose a huge burden on the Australian economy in the range of tens of billions of dollars a year.
In the last 10 years, we've managed to identify hundreds or even thousands of genes associated with mental illness.
Anxiety and depression, as well as schizophrenia, bipolar disorder, autism spectrum disorder, ADHD.
There is a large amount of stigma around mental illness. So typically people might think it's just all in your head, that you're feeling a bit down, but what our studies show is that there is a very large genetic component, really pointing that there's a large biological basis.
How are we going to use all this genetic data that we have and the hundreds of genes that we found, or thousands of genes for some diseases, and how are we going to use that information to bring it back to the patients? It's actually time to move to the next steps. We identified a couple of challenges that we are facing before we can translate these genetic findings to the clinic.
The greatest of those challenges is using the genetic information to understand the underlying biology of mental illness. At the moment, it's really hard to do this research and there's not enough funding happening at the moment.
Like, we really need resources to do our work. If we find the salaries of these brilliant young people, we will find more effective treatments for mental health diseases.
I think this is incredibly important. We can use genetic data to identify potential drug candidates that can be repositioned or repurposed. Possibly we can also use these data to improve prediction.
If we could medicate properly the first time or have more knowledge about what medications are contraindicated. I'm not a medical doctor, but my sense is that this would vastly improve the quality of many people's lives.
I'm extremely hopeful that we can use this information really to improve the lives of people living with a mental illness. We just need the funding in order to be able to achieve these goals.